Welcome, ladies and gentlemen. In the following few minutes, please let me introduce my one-year work regarding my PhD topic, which is about a translational approach for better awareness of cystic fibrosis-related glucose abnormalities. As well as I'm a PhD student, I'm also a pediatrician resident who is involved in the clinical care of children with cystic fibrosis. Therefore, my vision is to improve the life quality of these patients by applying up-to-date scientific research in the clinical assessment of cystic fibrosis-related glucose abnormalities. To estimate the significance and assess its global and local prevalence, we are conducting a cohort analysis and a meta-analysis regarding this topic. The life expectancy of cystic fibrosis increased in the past decades thanks to new therapeutic options. Therefore, complications that need time to evolve, such as osteoporosis or our interest, cystic fibrosis-related diabetes, have come into light. The diagnosis of diabetes is associated with increased mortality, which could be avoided by early recognition and treatment. By the age of 40, approximately half of the patients have diabetes. But we have to think about diabetes as the end stage of a progressive disease, the abnormal glucose tolerance spectrum. Before diabetes, there are prediabetic conditions, such as impaired glucose tolerance or impaired fasting glucose. Basic scientific research suggests that these prediabetic conditions start at early ages. Despite that fact, oral glucose tolerance test, which is the gold standard method for diagnosing this glycemia, is only recommended from the age of 10. Therefore, characteristics and dynamics of the progression between the different glucose tolerance status is still unclear. That's why we would like to know the exact prevalence of abnormal glucose tolerance in different age groups of cystic fibrosis. We hypothesize that abnormal glucose tolerance is more prevalent under the age of 10 in patients with cystic fibrosis compared to a healthy population. After the systematic search and the selection process, 597 articles were included in our meta-analysis. Due to the vast amount of data, we investigated several outcomes. The size of the circle and the number it represents the amount of articles included in each outcome. Now I would like to talk about the three most important ones signed by the red circles. Firstly, we examined the prevalence of abnormal glucose tolerance in different age groups of cystic fibrosis. According to our results, the prevalence is 31% in the pediatric population, which significantly increases during the adulthood, reaching 51%. Comparing these proportions to the prevalence of abnormal glucose tolerance in an age-matched general population, according to the International Diabetes Federation, the prevalence of abnormal glucose tolerance is 6 times more higher in the pediatric cystic fibrosis population and 2 times in the adult cystic fibrosis population. Furthermore, detailed subgroup analyses were performed in the pediatric population, and interestingly, there is no difference between the pediatric subpopulations. And I have to emphasize that this is the whole spectrum, including prediabetic and diabetic conditions as well. Why it is important? Because secondly, we examine the prevalence of diabetes, the end stage, in different age groups of cystic fibrosis. Based on our results, the prevalence is 9% in the pediatric cystic fibrosis population, which increases significantly during adulthood, reaching 27%. Comparing these proportions, we can see that the prevalence of diabetes is 90 times more higher in the cystic fibrosis population compared to the general age-matched population, and 2 times in the adult population. With further subgroup analysis, we can see that the prevalence increases during age with 0% in the 0 to 5, with 5% in the 5 to 10 years of age, and 11% in the 10 to 18 years of age subpopulation. That increase can be seen in the following diagram, where the red line represents the risk to have diabetes as a function of age, framed by the gray lines, which are the 95% confidence intervals. As you can see, the risk to have diabetes increases by age most rapidly during the puberty, but that increase starts before the age of 10. Of course, our meta-analysis has its strengths and limitations. This is the first meta-analysis, including high number of studies with high number of cases. But the age and the subgroup definition are not equally detailed in each studies, and there is a high heterogeneity due to the involvement of the different superselected cystic fibrosis population. But with further subgroup analysis, we were able to earn further knowledge about these superselected populations, which I couldn't show you due to the lack of time. In conclusion, we can say that abnormal glucose tolerance is highly prevalent in cystic fibrosis, even under the age of 10. But under the age of 10, only 15% of the abnormal glucose tolerance cases are end-stage diabetic, whereas among the teenagers, 1/3, in the adulthood, half of the abnormal glucose tolerance patients are diabetic. Therefore, better awareness is needed for screening and treating abnormal glucose tolerance in cystic fibrosis, especially under the age of 10, where most of the cases are still reversible. It's time to reconsider the current guidelines and start oral glucose tolerance tests younger than the age of 10, and after the diagnosis, start dietary intervention as soon as possible. There's an urgent need to develop a patient-friendly screening method which is suitable for diagnosing even for toddlers who cannot drink the sugary liquid for OGTT. As you can see, we are just finalizing our draft to an internal review. What is the prevalence of abnormal glucose tolerance among Hungarian children with cystic fibrosis, and what happens with them after the diagnosis? The Cystic Fibrosis-related Pancreatic Disorder Registry's aim is to assess the prevalence of this glycemia in our registry patients, especially under the age of 10. Currently, 110 patients are involved in our registry, from which we have analyzed the baseline data of those 79 patients whom were able to undergo OGTT and were previously diagnosed with diabetes. The OGTT was performed for 3 hours with measurement in every 30 minutes. The long-term aim of this study with the yearly reevaluation is to examine the characteristics and dynamics of the progression between the different glucose tolerance status. As you can see, half of the patients had 2-year follow-up visits, and a quarter of patients had 3 or 1-year follow-up visits. By analyzing the baseline data of the 79 patients, and according to the oral glucose tolerance test and further results, we can see that abnormal glucose tolerance is highly prevalent with 30 to 40% in every pediatric subgroup, even under the age of 7 or 10. In this age group, the prevalence of diabetes is 9%, with increases with age, and in the teenagehood it reaches 30%. And why it is important? Because when you visualize the glucose tolerance status and the basic characteristics of the patient, you can see that the more progradiated is the glucose tolerance status, going from normal glucose tolerance to diabetes, the worse lung function and the bacterial colonization by looking at the forced expiratory volume parameters and the chronic Pseudomonas aeruginosa infection. Our results of the cohort study and the meta-analysis harmonize, since both underline that abnormal glucose tolerance is highly prevalent in cystic fibrosis, even under the age of 10, where screening is not mandatory according to the current guidelines. However, early diagnosis and treatment is crucial, as an uncontrolled glycemic status leads to rapid clinical decline. And as Winston Churchill once said, however beautiful the strategy, you should occasionally look at the results. And here was the occasion. Thank you for your attention.
In the first project, you have mentioned that OGTT is not commonly done in patients under 10 years old. So my question would be, what was the measurement, the method of assessing this glycemia in patients under 10 in those 500 odd studies that you have looked at?
Thank you for your question. It's an excellent one. Actually, the guidelines do not recommend it under the age of 10, but patients around 4 or 5 years of age, depending on the patients, can drink the liquid for OGTT. So it's just a matter of trying, not the guideline. So we tried with patients with 4 or 5 years of age, and they could drink all the same sugar liquid which is needed for the oral glucose tolerance test.
It's a great work, congratulations, really. I'm wondering whether the genetic background of the patient with cystic fibrosis could influence somehow the frequency of impaired glucose tolerance. I think it's more frequent in those who have the delta F508 mutation, or it's different in other mutation. Do you have any data regarding this?
Thank you for your question. Yes, as you mentioned, I just couldn't show you due to the lack of time, but we did a subgroup analysis on data F508 mutation, homozygous mutations, and it's revealed there is no difference between the general cystic fibrosis population compared to this homozygous one, which is very interesting. And we didn't find enough data for other mutations, so we didn't do another subgroup analysis.
Okay, thank you. It's interesting result.